This episode is sponsored by Dr. Chrono by EverHealth, the #1 mobile all-in-one EHR. Built specifically for medical practices, Dr. Chrono includes an integrated feature that powers a seamless payments acceptance experience. Dr. Chrono Payments offers multiple ways for patients to pay as well as insurance credit card processing. As a Dr. Chrono customer, you can easily activate our fully integrated payment solution that will streamline your cash flow and help you get paid anytime from anywhere. Deliver the best patient experience with a fast and easy way to collect payments. Visit drchrono.com/payments. That's drchrono.com/payments to learn more about Dr. Chrono today. Is there a DPC clinician, tech vendor, or industry champion that goes above and beyond to further elevate the DPC movement? Nominate them for a DPC Innovation Award to recognize them for creating traction, embracing innovation, and demonstrating commitment to the movement. DPC Innovation Award winners will be announced and honored at this year's Hint Summit, taking place in Denver, Colorado, September 27th through 28th. Nominate a DPC innovator at summit.hint.com, plus get $50 off your Hint Summit 2024 registration with promo code MyDPCStory. Direct primary care is an innovative alternative path to insurance-driven healthcare. Typically, patients pay their doctor a low monthly membership and, in return, build a lasting relationship with their doctor and have their doctor available at their fingertips.
Hello everybody, my name is Dr. Diana Girnita. I am a rheumatologist, and for me, direct care means easy access, affordable, transparent healthcare, and it gives me the opportunity to be the advocate for my patient needs. I am the founder of Rheumatologist ONCALL, and I want to thank you for joining us today to hear more about my direct care story.
Welcome to the podcast, Dr. Deanna.
Thank you for inviting me.
I wanted to start by asking you about your recent move to California. When did you move to California and where did you move from?
It is true, I recently moved to California from Cincinnati, Ohio. I'm currently located in Palo Alto, and the move was because my husband was recently recruited as a professor of transplant immunology at Stanford University.
Well, welcome to the state, Deanna. It's definitely not a usual year for the state, but I hope it's been a good fit for you so far.
It was not easy to move a family with 3 kids across the United States, but we all hope that we choose the right place for us.
On that note, you have already opened up your direct care practice in rheumatology. I really am interested to find out how you came to learn about the direct care model.
I will tell you sincerely, I found out about the direct primary care model somewhere in 2015, 2016. One of my senior residents talked to us about starting a DPC model. Her name is Becky McGilligan, and she has today a direct primary care practice in Cincinnati, Ohio. Just recently, a very good friend of mine and colleague, also a rheumatologist, Dr. Lou Flaspoller from Cincinnati, he actually introduced me very passionately to this healthcare movement.
That's wonderful that you had that exposure, even dating back to 2015, and have allowed it to blossom now into your actual practice in direct care. When you look at the direct care model versus staying in fee-for-service, what drives you to stay in direct care now and in the future?
I was actually practicing in a very traditional private practice back to Cincinnati. It was very successful, but it became very, very busy. And like all female physicians, we have to balance our life with our career. I thought that my life became too busy to take care of my family. And the fact that I had no time to dedicate to patients as I wanted, that was something that pushed me back.
As a mom, I totally empathize with you, Deanna. Dr. Amber Beckenhauer, who is also in her own DPC, thriving DPC practice, who we'll have on the podcast later, she told me once, that we in DPC can really show that we are not only doctors, but that we are able to be human too. And that family balance is so imperative for our own mental and emotional health. And that's wonderful that you are taking into consideration your family in planning and executing your future.
I also have another reason. The fact that the healthcare became so complicated and we were driven in our care more by the RVUs that we are producing than concentrating on the patient care. That was something that also pushed me back. In addition to that, many times I wanted to dedicate more times to patients, but I had a few others waiting already for me.
It's so true. That RVU system is so dehumanizing for both ourselves as well as our patients. And it's so wonderful to have an alternative model of practice so that we can do what we all set out to do in medical school.
That's very true.
With you having opened your practice this past August, how are you marketing or getting the word out about your practice?
Many patients from Cincinnati area, they know me and they wanted to follow me. For about a year or a year and a half, I was trying to introduce the idea of practicing telemedicine to my own private practice in Cincinnati. However, like all new ways of delivering care, I encountered a lot of resistance. People were more concerned about how they will get reimbursed, if they will be liable for certain things that they do on telemedicine, and they tried to discourage me. Seeing patients that were traveling for an hour or an hour and a half to come for an appointment where they physically will spend with me about 10 minutes drove me to the idea to start this practice.
I can't imagine, especially, with my own patients who have rheumatologic disease, gripping the steering wheel is something that is difficult for people to manage. And the closest rheumatologist in our area is about an hour and a half away. So I completely empathize with you in terms of you noticing that it was just unacceptable for your patients and that you wanted to bring them accessible care. And thank goodness now you don't have anyone to approve what you do or don't want to do with your practice.
This is true. In rheumatology, there are a few layers that we have to overcome. It's not only seeing the patients, but also getting approved the treatment for them or getting approved basic lab work or imaging studies. That became a very difficult process when you deal with insurance companies. On the other hand, the fact that the cost of our visits and laboratory workup and imaging is so high, patients are afraid to come for an appointment. The waiting time for a rheumatology appointment, as you said, is between 4 and 6 months. My goal is to drop that to a few days and maybe, if it's too busy, to a few weeks, but no longer than that.
Again, you're hitting on the nose the need for accessibility, and you're now able to provide that. I want to ask, because you mentioned about labs and x-rays, what do you have set up for your patients in terms of helping them financially be able to do labs and or x-rays?
Because I was able to build up this practice, I was also able to negotiate excellent prices for their labs. I'm still working to get prices for imaging studies. However, for labs, I was successful to get incredible prices. Many of our medication, they do require monitoring of their labs every 3 to 4 months. You would not believe the cost of these labs, how low I was able to find that they could be through my practice. I will give you an example. For basic labs, the price could be around $20, which is unbelievable in a traditional brick and mortar, traditional healthcare system.
Stay with us. We'll be right back. Thank you to Spruce Health for supporting the My DPC Story podcast. The ways we communicate have changed dramatically over the past decades, but technology and tools in healthcare have not kept pace. Patients want more access and digital convenience, as well as the ability to text their care teams. Care teams are inundated with more communication and rising expectations, but are still using tools and technology stuck in prior decades. Spruce Health created a solution for the tech-forward DPC practice by creating a communication product designed to serve both the patient and the doctor through intuitive HIPAA-compliant workflows, tagging, scheduled messages, and triage templates ready for use, whether you're on your phone or in the exam room. New users get 20% off for the first 12 months of a paid plan with code MARYAL20. That's MARYAL20. So check out Spruce Health today at sprucehealth.com or check out the link in the show notes. Absolutely. And we see that when patients shift to direct primary care and direct care models, they're blown away by the actual cost to do blood work, like basic blood work, a CBC, a CMP, and especially that you are a rheumatologist getting a lab panel that you need to constantly monitor for $20. That's just incredible to hear. In terms of your practice and the fact that you have patients in multiple states, how do you communicate with your patients for their visits?
I do use a portal for patients to sign up and communicate with them. The portal is called Breeze. However, I am looking for alternatives to find an easier way for patients to communicate. As you all know, when we start with something that we believe is the best thing that we could ever find. But working with that system, you might decide might not be the best idea, or you might have better alternatives there. So I am communicating freely with them at this point, but I'm also looking to something easier for them to use.
That's so relatable for myself, but also I'm sure for a lot of the listeners, just because that's how we become successful in our endeavors to offer direct care and direct primary care to people. When we adjust our practice to fit our needs as well as theirs, and to be able to improve on that in the future, again, it just attests to how wonderful this model is. Deanna, you treat both autoimmune and infectious conditions. Could you please share with the listeners some examples of conditions you manage and what ages you focus on?
I am focusing on adult rheumatology. I do not treat pediatric patients. My practice will focus on inflammatory arthritis, such as rheumatoid arthritis or psoriatic arthritis or ankylosing spondylitis. And I'm also focusing on autoimmune diseases, such as lupus or Sjogren, scleroderma, or different types of vasculitis. I also treat patients with osteoporosis, but sometimes I share that disease with endocrinology. In the rheumatology field, many of the inflammatory arthritis, they get to us very late. So I would encourage direct primary care physicians and all primary care physicians to reach out to us sooner when they think that they have a very young patient with joint pain that look inflammatory in nature. And I would like to point out a few things, such as morning stiffness, joints that are painful and also swollen, and the fact that they improve with movement. I would like primary care physicians to give me a call and discuss the case with me. It is not normal for a young patient to come with joint pain unless they have been in a car accident or they had a traumatic experience on their joints, or if they had a recent infection. I would like them to reach out to me to discuss those cases. They could be extremely devastating, and they could cause permanent damage in about 2 years from the onset of the disease.
Thank you for being open to discussing with direct primary care doctors about uh, early diagnosis of patients. I think that that should really hit home for all of us, especially given that we might be seeing younger people who might have already had a delay in their care because of cost of insurance-driven healthcare. I want to ask specifically, with this pandemic, are you seeing any changes in the world of rheumatology with regards to COVID?
Actually, I think March 2020 was the cornerstone for the traditional system to accept telemedicine. At that date, Medicare accepted to pay the fee for service as a primary care physician will see the patient face to face. Later on, other plans started to accept the idea. However, they did not pay in full, or there were a lot of discussions for reimbursements. Telemedicine became accepted both by primary care physicians, specialists, as well as patients. I was reading last night that the visits for telemedicine, they reach about 1 billion recently. So that shift in accepting telemedicine, it's incredibly valuable for patients and for the access to healthcare. Recently, there were a lot of discussions about the importance of vitamin D. We know for a while that vitamin D is very good for our cardiovascular system, for our immune system, and there were some recent studies that they prove that vitamin D boosts our immune system, and it could be helpful for fighting the virus. Vitamin D is also important for all our patients that experience a lot of fatigue. Many times patients with fatigue, they might have a deficiency in this vitamin, and that could be very easily corrected by taking a supplement.
When you speak with your patients about the potential for vitamin D deficiency, is there a particular strength or level of vitamin D that you recommend on a daily basis?
I would definitely check the vitamin D level. Many of our patients, they spend very little time in the sun, and our vitamin D gets activated in the skin after about 10 minutes spent in the sunlight. Many of us, of course, in these times, we spend most of our times in the house. So I would start by checking the vitamin D, and if it's very low, I would recommend about 50,000 units every week for 12 weeks. And if it's towards the normal value, then I will still recommend 1,000 to 2,000 units every day. The dose of vitamin D is still disputable, but this is the most common approach that most of the rheumatology specialists have.
Thank you for sharing that information about vitamin D. In addition to your management and treatment of diseases in the rheumatology world with traditional medications, DMARDs, etc., you also focus on mindfulness, anti-inflammatory diets, exercise, and sleep. Can you please tell us a little bit more about that?
Definitely. I use evidence-based medicine to treat the autoimmune diseases, and I always involve the patient in that decision. However, I also discuss with my patients about integrative medicine. This is to complement not to replace the evidence-based medicine. I strongly believe that having a proper nutrition and following a regular exercise pattern and focusing on a good quality sleep as well as mindfulness techniques will bring a lot of benefit to patients. I myself took an MBSR course, which is a mindfulness stress-based reduction course from University of Massachusetts to understand better before I introduce the patients to these concepts. Mindfulness is a very powerful and very cheap way for patients and for all of us to achieve and to look at our life differently. All these patients with chronic conditions, they tend to be very anxious and very depressed. By changing the mood or changing the focus on a positive aspect of life, you can improve quality tremendously. I would like to point here the work of one of the professors from University of Massachusetts, and he's not the only one, but he was the one who started this work. His name is John Kabat-Zinn. This PhD professor, he started the work to prove that mindfulness is a powerful way of improving the life of patients with autoimmune diseases. There are many, many studies coming out from huge names, huge universities like Stanford or Harvard or Vanderbilt that they prove the same thing, that people and patients that practice mindfulness, they will have a better quality life and they will respond better to treatments and their level of pain and mood will improve significantly just by practicing simple breathing techniques.
I love that you mentioned Dr. Zen. His work is definitely life-changing when you read about it. So I love that you mentioned his name specifically, especially with people being isolated in their homes and isolated away from family and friends compared to what used to be our normal. Having mindfulness is definitely something that can be useful for not only those with chronic diseases, but also uh, everyday patients who might not usually have been anxious. I definitely see patients who did not talk to me about being anxious or being depressed in the past now experiencing those feelings. And you're very right in that mindfulness does not have to be an expensive form of treatment, especially if it is practiced regularly and it becomes a habit like brushing your teeth. So thank you for mentioning that.
I would like to mention then that on my website, patients will find information about discounts to the major apps that are available today. You know, apps like Calm or 10% Happier or Headspace. I was able to discuss with their sales team and got a discount, a significant discount between 25 and 30% for my patients that want to try it. It's 1 year membership and you will have the time to experience that. All I'm asking people is to remain consistent about this approach.
Absolutely. And those are fantastic resources that I have also recommended to my patients. So that's great that you were able to find a discount for those who are interested. I definitely find that for my patients, they really appreciate the sleep stories that both Headspace and Calm offer. I haven't had many use 10% Happier. I know that they have a podcast as well, but Headspace and Calm specifically, I've had a lot of people who had rumination issues, anxiety issues that were preventing them from getting quality sleep. And those sleep stories, especially the meditations that can be 30 minutes, are definitely helpful. So thank you for mentioning those. I have become a huge fan of podcasts. Ever since Sarah Koenig hosted the first season of Serial, I was hooked. Now, creating this podcast has become part of my daily life. While it is an exciting new hobby, I also see it as a privilege that I get to interview so many DPC and direct care doctors. If you are interested in starting a podcast, let me tell you a little bit about Anchor. First of all, it's free. There are creation tools that allow you to record and edit your podcast right from your phone or computer. Anchor will distribute your podcast for you so it can be heard on Spotify, Apple Podcasts, and many more. You can make money from your podcast as well with no minimum listenership. It's basically everything you need to make a podcast all in one place. Download the free Anchor app or go to anchor.fm to get started. You obviously have a passion for teaching, given that recently on the DPC Docs Facebook group, you hosted a Zoom for primary care, and it was in the format of a question and answer session with regards to ANAs, when to order them, what's a good approach to a patient with if you are concerned that they have a rheumatologic issue. What are your plans with this type of format in the future?
I am actually very excited that people were so receptive to embrace this idea. I have been doing that with, particularly with certain primary care physicians in the past, and I will continue to provide these sessions. And I think I will like to do it every month. And I'm more than happy to have patients, have primary care physician call me when they have a case in their office, discuss the case with me, and we can, order the appropriate labs. We can discuss what will be the most cost-effective approach. We can discuss what will be the imaging, and after we have everything done, we can decide if the patient needs to see me or not. In this way, we will save the time for the patients and definitely save on the cost that the patient will have if they come directly to a specialist. It could also cut down in the anxiety that the patient will develop between the time that he's seen by his primary care and the specialist. And you guys are there with the patient. You can provide me a lot of information just by asking the patient. I love teaching. I was involved in teaching for a long time, and I teach medical students and I also teach medical residents. In the last 4 years, I'm happy to say, and I'm very proud to say that I was able to promote 4 internal medicine residents into rheumatology fellowships. And you all know how competitive this became in the last 10 years.
Absolutely. And we will include the link to your Zoom Q&A session with the blog post that accompanies your podcast on the podcast website. If you get a chance, for those listeners out there who may have not tuned in to Dr. Deanna's presentation, it's quite informative and presented in a way that I was able to use the information that she gave through that Zoom the next week in clinic. You just shared with us that through your teaching and inspiration, 4 residents went from internal medicine to focus on rheumatology. For those people who are in rheumatology or other specialties and are toying with the idea of direct care or interested in opening their direct care clinic, what are some words of wisdom that you could give them to inspire them to make that jump?
I think that once you are trying to look outside of the traditional system, it means that you are already on a great path. Many of us, we are trapped in the RVU factory. We are trapped in the unfair reimbursements. So when you look at the direct primary care system and their interaction with the patients, many of us are very jealous, but we don't know where to start. And for me, in the last eight months, it was an incredibly important learning curve. I was able to discuss with a lot of people, and I was open about what I wanted to do. Once you reach out to people from the direct primary care system, they are very happy to embrace you and they are very happy to help you. I found wonderful physicians that they guide me, they answer me questions that not even lawyers were able to answer me. And I wanted to encourage them to look for alternatives because we don't have to become overwhelmed. We don't have to stop practicing medicine. I personally hate when I hear my friends, physicians, that they tell their kids not to choose medicine anymore. I actually am encouraging my kids to look into medicine. I think there is a wonderful profession that will give you reward like no other profession. And I want to applaud all the DPC physicians for taking the lead of change. I also want to congratulate the patients that are open to find out and sign up for this alternative, because I've seen and I have experienced the fact that once patients come to us and they are not stressed about the time that they have to spend with us, they're not stressed about the cost of the laboratory that I have to order. I am opening up and I say to them, this is how much it's going to cost this is how much is going to cost this, and they can choose their priorities. I'm also able, through a lot of digging, to find out resources for their medications for DMARD, not for biologics. But I was able to obtain incredibly prices for medications as well. And once the patient know that they have hope, they have alternative, they will spread the word and more patients will come to us. When you are a specialist, our fear is that being there without a healthcare system behind you to refer you patients, they are afraid that they will not have patients to search for them or look for them. And I think communicating with primary care physician is the key, keeping them close, answering them questions in an honest way and directing them, it's going to pay back in time.
Deanna, if a person would like to reach out to you and connect, what is the best way for them to do that?
I have a website that is called dianagirnitamd.com. They can also use my email, which is drg@rheumatologistoncall.com. And I also have a Facebook page that's more for patients. It's an educational Facebook page. It's called Rheumatologist on Call. They can reach out to me in any way, and I'm more than happy to connect and find solutions for them. Once again, I want to disclaim that I'm licensed in 4 states, and those are California, Ohio, Indiana, and Kentucky. And only in those states at this point I'm able to see patients, but I'm more than happy to direct you in to help you otherwise if you are in need for in one of the other states.
Thank you so much, Dr. Deanna, for joining us today.
Thank you. I feel honored that you invited me, and I wish everybody a better year.
Next week, look forward to hearing from Dr. Mitch Lee of Thrive Direct Care. Until then, this is Marielle Conception. For more information on this episode and much more, please visit mydpcstory.wixsite.com/mysite. That's mydpcstory.wixsite.com/MYSITE.